Then she'll moderate the first session of the workshop. Dr. Wartella is the Al-Thani Professor of Communications and holds secondary appointments as Professor of Psychology, Human Development, and Social Policy, and Medical Social Services. She's a total 360 scholar at Northwestern University. She also directs the Center on Media and Human Development in the School of Communication at Northwestern. She's a member of our standing committee, has been a member, a chair of several other IOM committees, including the committee that wrote the landmark 2006 report on food marketing to children and youth.
Thank you. Maybe we can pull up my slides. I'm conscious that I have about 20 minutes to try to give you an overview. And so what I thought I might do is to start by at least asserting the power of food marketing in the childhood obesity crisis. Children are exposed to an enormous amount of advertising. Unfortunately, and particularly for foods, and unfortunately most of the data that we have regarding exposure comes from data on television advertising, and television is still the major medium that children use. In 2009, children aged 2 to 5 saw an average of 10.9 food advertisements per day, while children aged 6 to 11 years saw an average of 12.7 ads. And 86% of these ads were for food products that are high in saturated fat, sugar, and sodium. And indeed, a trend analysis of food advertising categories suggests that there's been actually an increase in children's exposure to television advertising for things like sodas and for other sorts of sugared sweetened drinks. So I'm not going to belabor the point of talking a lot about the particular exposure, but I thought what I might do is go back to the landmark study from 2006, which was the first Institute of Medicine study to look at food marketing and its relationship to children's diets, and review for you the recommendations from that study and talk about what's happened since that report, since it was a landmark report that raised public awareness about the food marketing's role. The study task was to review evidence for food and beverage marketing practices that might influence children's diets. It was a congressional request to the CDC that went then to the Institute of Medicine for this 18-month study. There were 16 members of the committee drawn from industry, government, academics, nutrition scientists, psychologists, a very wide-ranging group. And as you heard, I was a member of that committee. We began by looking at the notion of what marketing constitutes, and marketing is a process of informing and persuading consumers to buy products. It's a central feature of American business and of American consumerism. It involves conducting marketing research and analyzing the target audience, analyzing the competition, and it involves a variety of strategies, of which advertising is simply a part of promotion. So it's a subset of the idea of promotion. We also looked at trends in diet and eating patterns of American children in that report, and we found that by and large, today's diets depart from the recommended patterns and reflect a pattern that places youth's health at risk, with higher than recommended intakes of sugar, sodium, and fats. Most children and youth in the United States have not been meeting the daily recommendations for whole grains, fruits, and vegetables over the past decade, and children have inadequate intakes of calcium, potassium, fiber, magnesium, and vitamin E. Disturbingly, milk consumption has decreased over the past 35 years, while sweetened beverage consumption has increased. And in short, children and youth, by and large, have a diet that is high in calories and low in nutrient density. Perhaps the most persuasive part of that 2006 report was that we conducted a systematic evidence review of the studies that were available at the time that looked at the relationship between food marketing and children's food preferences, purchase requests, food diets, and we tried to look at adiposity. That study examined, through multiple sources, approximately 123 studies that had enough transparency that we could really assess the quality of the relationship between marketing and these outcomes. almost all of those studies were only on TV advertising. Other marketing practices had not been part of the literature at that point. And the findings were as follows: that there was strong evidence of TV advertising effects on food and beverage preferences, purchase requests, and short-term food and beverage consumption for 2 to 11-year-olds, and insufficient evidence, because there simply weren't enough studies, to draw a conclusion about 12 to 18-year-olds. There was moderate evidence that advertising effects on food and beverage beliefs and usual dietary intake of 2 to 5-year-olds, and weak evidence for children 6 to 11, and weak evidence that advertising does not influence the dietary intake of teens. But again, we didn't have enough studies to draw stronger conclusions. And while there was strong evidence that exposure to TV advertising is associated with adiposity in children 2 to 11 and teens to 12 to 18, the data were primarily correlational. And as a consequence, the committee concluded that there was insufficient evidence to conclude that there's a causal relationship between exposure to TV advertising and adiposity. But we found no studies that contradicted that relationship. The committee concluded that food and beverage marketing influences the diets and health of children and adolescents, and that current marketing practices are out of balance with a healthful diet. That it puts young people's health at risk, that companies and marketers have underutilized their potential to apply resources and creativity to market a healthful diet, and that achieving a healthful diet will require industry leadership and a sustained multi-sectoral and integrated efforts. Also, we noted that current public policy lacked support or authority to address many of these issues. The IOM report in 2006 then went on to make recommendations for approximately 10 different stakeholders who were involved. And what I'd like to do now is turn to those specific recommendations and give you a bit of an assessment of what's happened to those recommendations. And I'm going to be drawing on 2 recent articles that were published along with my co-authors, Vivica Craik, Mary Story, who's a member of this committee. Vivica Craik, by the way, was the study director for that 2006 IOM report on food marketing. And what we did was to go back and assemble evidence to look at what had happened to the recommendations. We covered the period between December of 2005 through January of 2011, and we did an in-depth environmental scan to try to determine what kind of outcomes had occurred and whether the recommendations had been followed by the various sectors. We used something called the LEAD principles, which happens to be a report from this committee of how one would go about locating, evaluating, and assembling decisions in a policy arena. We reviewed a variety of academic articles, industry articles, government reports, et cetera, et cetera. In the case of looking at the recommendations from industry, we evaluated over 117 evidence sources. And in the case of government and the schools, we had about 80 evidence sources that we looked at. So let me talk about some of those specifics. Let me give you an overview first. So I'll give you the conclusions, and then I'll try to give you some more evidence specifically. Overall, what we found was that the evaluation showed that there was that extensive progress was not made by any industry stakeholders to achieve the IOM recommendations. That moderate progress was made by the food and beverage companies between 2005 and 2011, and that in cooperation with public sector groups, there were attempts to improve marketing practice standards. Very limited progress was made by restaurants, industry trade associations, entertainment companies, and the media over this period. The schools made some moderate progress, and government made limited progress. And indeed, our conclusions were in the form of no progress, limited progress, moderate progress, or extensive progress. We found no sector having made extensive progress at that time. So what I'd like to talk about are some of the specific areas And I don't have time to give you a full description of them, so I recommend you go to the American Journal of Preventive Medicine. The articles that review this literature were published in September of 2011 and March of 2012. And I believe Vivica Craik is the first author on all of those, both of those pieces. And there's more detail in those. So I'm going to gloss over a little bit just to give you a sense of what's going on in this environment. If you look at the food and beverage companies and their role in promoting healthier products and healthier foods for children and youth, the industry reports suggest that progress was made to reformulate and expand healthier products. Progress was made to reduce TV advertising for unhealthy products, particularly sweet snacks and sugared sweetened beverages. And that there was the development of more front-of-package labeling for consumers to identify healthy products. And there was the development of partnerships to promote a healthy diet and lifestyle. In 2006, perhaps the most important event, which occurred a few months after the release of that food marketing report, was the establishment, first by 10 food and beverage companies, now up to 17 or 18, of the Children's Food and Beverage Advertising Initiative, a specific self-regulatory arm to promote healthier food and beverage marketing to children. And I'll talk a little bit about that. When the CFBAI was established in 2006, they had less than 50% of the market, of the marketers for food and beverages to children, and they had guidelines that were inconsistent from one company to the next. Those guidelines have been revised in 2009, 2010, and most recently in 2011. And the guidelines have improved considerably over that time with common nutritional standards, and they now cover media far beyond just television advertising, but all of the different ways in which marketers try to reach children. The other thing that I would mention about the food and beverage companies is that there's been a considerable amount of assertion that there's been product reformulations. And when others have looked at that, there's some question about how the product reformulations have really led to considerable changes in what is marketed to children and youth. For instance, a 2010 review by the Rudd Center found that of the 84 popular brands of ready-to-eat cereal, 1/4 met the voluntary nutritional standards set by the government in 2010. So it's a question of whether the reformulations are actually meeting the kind of nutritional guidelines that nutrition scientists would want. More importantly, the area that has had very little reaction have been the restaurants. There we found really limited progress being achieved. Full service and quick serve chain restaurants made limited progress to expand and promote healthier meals and provide calories and other nutritious information at point of choice and consumption. In 2010, for instance, the Rudd Center again released a study examining children's and adolescents' meal choices at 12 quick service chain restaurants. The study documented that only 12 of the 39 children's meal combinations met established nutrition standards for preschoolers. Only 15 meals met nutrition standards for older children, and meals purchased by adolescents provided an average of 800 to 1,100 calories, and meals sold to young children rarely offered healthy side dishes as a default choice. And so there's some limited, if to moderate, progress that's being made in that sector. Recommendations were also made for the industry trade associations, and we concluded that limited progress was made in this area. In particular, only 3 trade associations are members or partners of the Healthy Weight Commitment Foundation. Most of the trade associations have had little to say about food and nutrition. More recently, in 2010, the Grocery Manufacturers Association stepped out in the fall of 2011 and announced that it was going to establish what it first called Nutrition Keys, which was a front-of-pack symbol system to alert consumers to what are healthy products. They now call that program Facts Up Front. They also said that when they released that new program that it would come with a $50 million educational campaign. From what I understand, that campaign has not started, and the facts up front approach hasn't been adopted as widely as the Industry Trade Association had hoped it would be. In terms of marketing practice standards, we concluded that there's been moderate progress achieved. As I mentioned, the Children's Food and Beverage Advertising Initiative is now has 18 companies and covers about 80% of foods marketed to children and youth. The revised standards seem to be much more consistent. In 2011, they announced that 4 companies have committed to no advertising to children under 12. Those are Cadbury, Adams, Coca-Cola, Hershey Company, and Mars. 13 companies pledged to advertise only foods that meet DGA and Food and Drug Administration standards, such as FDA's definition of healthy. And now the standards for those who are pledging to be part of CFBAI covers all media platforms, not only advertising directed to children under 12, but radio, print, the internet, advertising on video and computer games, push advertising to cell phones. It's really the broad range of the variety of venues through which marketing is reaching children. I'm going to go quickly. In terms of media and entertainment companies, we concluded that there was limited progress that had been made by 2011, that only about a quarter of entertainment companies had a clear policy on food marketing to children, as a 2010 report by CSPI noticed, that existing policies addressed third-party licensed characters, but were weaker for products marketed through broadcast, print, and digital media. Primarily, it was Walt Disney and Sesame Workshop that reported limiting children's marketing to products meeting specific nutrition standards. The Cartoon Network developed policies for licensed characters, and I must point out that the 2006 report suggested no licensed characters should be put on unhealthy foods for children. And Nickelodeon had neither nutrition standards nor a clear policy about food marketing. We concluded that there was moderate progress to date in the school environment. In particular, educational leaders, school districts, and local schools set about trying to create healthier eating environments for students. The IOM report charged stakeholders with developing and implementing such nutritional standards for foods and beverages, and to, in particular, adopt a model school wellness policies that would allow for the competitive foods to be more nutritious than they had been in the past. One of the most disappointing outcomes is in the government-public sector partnership. The committee recommended that there was a need for a social marketing campaign directed at the parents of young children and new parents to teach them about appropriate ways of introducing their children to foods and to set them off on a lifelong healthy diet and exercise routine. Unfortunately, that has never happened. There's been absolutely no progress in trying to implement that campaign. And when we assessed the progress made overall in public policy at the federal and state and local levels, we concluded that there had been limited progress achieved to date. We should mention that there have been successful attempts at public-private partnerships as a result of Michelle Obama's Let's Move campaign and the Partnership for Healthy America. But overall, there are a number of areas in which the government has not moved. And I think the most striking one was the 2009 Interagency Working Group recommendations for establishing nutritional standards for all foods marketed to children. Went round and around and was reviewed and went to the White House last spring, and it has died in the basement there. And nothing has happened on the IWG, which was probably even though those standards were supposed to be voluntary, it was probably the major policy around food marketing healthier foods to children. In terms of research, we concluded that the public and private research capacity has demonstrated some limited progress to date. I won't bore you with all of them, but NIH has supported some research. There's been research supported out of USDA, but I think it's safe to say that the Robert Wood Johnson Foundation remains the largest funder of food and beverage marketing research on children and adolescents, primarily through its healthy eating research group that Mary Story runs at Minnesota, and its various projects, including the Rudd Center for Food Policy and Obesity. Lastly, there is no evidence that, as recommended in the 2006 report, that there's been any federal agency assigned to monitor progress in obesity prevention, another report of the 2006 committee. I should point out that if you look overall, I've mentioned that there's been between limited and moderate progress on the recommendations. The 2012 Institute of Medicine report on accelerating progress on obesity prevention reviewed all of these reports and what has happened since the 2006 report came out and made recommendations very similar to the ones that we had made in 2006. In particular, they requested the suggestion that we should reduce overconsumption of sugar sweetened beverages, increase the availability of lower calorie and healthier foods for children in restaurants, implement the common nutritional standards, that's the interagency working group standards, and ensure consistent nutrition labeling for front of pack. In terms of these lists, we know that there's been some action at the municipality level. In September, New York City did limit the size of sugary drinks, and that the IWG standards have died. And right now, the Food and Drug Administration and the USDA has a report from October 11 from the Institute of Medicine suggesting a front-of-pack nutrition labeling and symbol system, but there's been no action on that yet. And let me conclude that if you look across the landscape since 2006, I think it's safe to say that there hasn't been no progress, and somewhere I would conclude between limited and moderate progress on the recommendations. That doesn't mean that there isn't more to do and that there aren't areas in which we have less information than others. And what's happened since 2006 is twofold. First of all, there's been a proliferation of new venues and vehicles, particularly the rise of digital media and ways of reaching children with new kinds of digital devices and new kinds of techniques, particularly aimed at adolescents. And I must say that when we did the report in 2006, there wasn't much of a body of research around adolescents. That's by way of my segueing to what's going to be the first panel, which is looking at some of the emerging issues regarding food marketing practices since that 2006 report. And we'll specifically look at the rise of something called integrated marketing and what that looks like and what that means, as well as marketing practices directed at adolescents and marketing practices directed at targeted ethnic groups, which, again, we didn't look at in the 2006